Welcome to today's update on COVID-19 in Alberta. Our apologies for the delay. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for Alberta. Dr. Hinshaw will provide a brief update and then we'll open the floor to questions.
Thanks, Tom, and good afternoon, everyone. Today we have confirmed 297 new cases over the last 24 hours, bringing the total number of COVID-19 cases to 4,017. Of the new cases, 3 are in a First Nation community within the Calgary zone. The infected individuals are in isolation, and the community is working with Indigenous Services Canada to prevent any spread. Alberta Health Services is also investigating 2 cases at the Mountain View Poultry Chicken Processing Facility in Okotoks. All supports are in place to prevent spread in that facility. 1,397 people in our province have now recovered from COVID-19. I must also report that there have been 5 additional deaths in the province. This brings the total number of lives lost to 72. My sincere condolences go out to everyone grieving the loss of a loved one today. Nothing can ease this pain, but please know we are doing everything we can to prevent further deaths from this illness. Since yesterday, I have heard from many Albertans who are profoundly disappointed or even angry about my statement regarding summer events. The message I am hearing is that Albertans have sacrificed so much already. How can I ask them to give up their summer when we don't know for sure what the situation will be like in 1 or 2 months? I hear this loud and clear, and the question of how we came to the decision regarding summer events is a valid one. So today I would like to provide more information on why I am convinced this measure is necessary. First, I know the curve shown in our modeling work may have left the impression that the virus will go away over the summer. That is not the case. The virus that causes COVID-19 will be with us for many months to come. And the relatively low case numbers we are seeing in most of the province are the result of our collective efforts and sacrifices. COVID-19 is still with us, and it spreads rapidly through social interactions. I want to give an example of how this happens. We have had several instances in the province of social gatherings where one person passed the virus on to many others at a single event before the individual knew they had COVID. The Bonspiel in Alberta is one example I have talked about before. Of the 73 people who attended that event, 40 ended up with COVID-19. We have had other social events where over 80% of attendees were infected. And the common theme in all of these is that the source did not know they had COVID, or there was possibly an environmental source with high touch surfaces. The attendees were trying to be careful with regular hand sanitization and trying to follow distancing rules, but the gatherings were social in nature. From these events, a single gathering resulted in between 13 and 40 additional cases, with subsequent spread to household contacts of those who attended. In some cases, these household contacts were healthcare workers. We are starting to map out the ripple effects of spread started by these gatherings. These gatherings happened early in our epidemic, before we fully understood the reality of transmission before the onset of symptoms. And I want to be clear, I am not blaming the people involved for this spread. What I want to underline is that the kinds of social gatherings we are used to, even in the summer, can result in significant spread of the virus from just one person who may not even know they are infected. The results can be explosive, far-reaching, and deadly. These are extraordinary times, and I am asking a lot of all of us. I hear every day of the things Albertans are giving up to fight COVID-19, and it does not seem fair to ask for more. Unfortunately, this virus does not respect our feelings. We have no easy options. We only have each other, and our commitment to protect one another by continuing to make sacrifices. I am keenly aware of the depth to which these measures are affecting everyone. I do not take them lightly. I ask you to do the same. Many Albertans may not feel directly affected by COVID-19, but there is a growing number of us who are. I want to talk today about the importance of supporting these people. For example, those affected by the outbreak in High River. Not everyone who works at Cargill is a close contact of a confirmed case. There is no reason to assume that everyone connected to that facility is infected. These individuals are not in mandated isolation unless they are a confirmed case or a close contact of a confirmed case, and should not be restricted from accessing businesses such as grocery stores or banks when necessary. The people who are affected by this outbreak are experiencing many difficulties, and they need support and compassion as we work to stop further spread. The same is true of all those working at continuing care sites experiencing outbreaks, including healthcare workers and many others. This also is true of those who may have the illness or be a close contact of someone who has it. In the interests of transparency, we will begin posting healthcare worker case numbers online next week. To start, these statistics will only reflect information from AHS staff. Recognizing there is a desire to have a clear picture of the broader healthcare worker population, Alberta Health Services is working to ensure physician data and Covenant Health data can be included as soon as possible. This data may give the impression healthcare workers are at greater risk of spreading the virus, but this is not the case. As I have said before, healthcare workers take hygiene and sanitization practices seriously at all times, and even more so now. Do not be afraid to reach out to them and offer support when needed. We need to thank those who are staying home because they feel sick, whether or not they have been tested. We need to make sure that by our actions and attitudes, we encourage people who are sick to get tested, so those people do not feel shame or fear that makes them hide their symptoms and risk further spread. I have spoken often about our new normal. I want to make sure that this new normal both maintains physical distance and encourages social connection, compassion, and understanding. The more we commit to this, the more effective we will be at stopping the spread together. I hear you when you tell me what you have given up already. I hear you when you worry for your children's well-being and the health of your loved ones. I know the sacrifices that are being made are taking a tremendous toll on all of us. I want you to know that I do not take these decisions lightly. I feel the weight of your sacrifice with every step we take, but I know they are necessary to save lives now and provide a path forward to a time when they are no longer needed. Thank you, and I am happy to take questions.
Excellent. We'll now open the floor to questions. In addition to Dr. Hinshaw, we also have Dr. Mark Joffe, Vice President and Medical Director with AHS, available if needed. Operator, could you please put through the first question?
First question is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. I'm wondering if there's any chance that professional sports will be played in Alberta before September 1st, and could exemptions be made if teams were willing to play in empty stadiums without fans and maybe with limited staff?
So I understand this is under discussion. I think this question came up a couple of days ago, and certainly as we look at our relaunch planning and the kinds of restrictions that we may be able to ease up on in the coming months, we would look at suggestions like this to determine if they fit within that relaunch plan. So at this time, it's a little early to say whether or not that will happen. But again, I think the important piece would be to assess what the risks might be and whether or not that can fit within the relaunch framework and what kinds of activities are allowed as we consider how and when we might slowly open up.
Operator, can you put through the next question, please?
Next is Jeff Slack with 660 News. Go ahead, Jeff.
Hi, Dr. Hinshaw. I have a clarification and then a question. My clarification is, you said that there are 5 new deaths today, but is it technically 4 because we had, the information said it was 67 total deaths and then that 1 wasn't going to be added?
Yes, that's right. So yesterday, when we had the 67 in our official counts, I did confirm yesterday there was 1 additional death that came in after our data cutoff. So you're right, today it's 4 additional deaths, but it's counting as 5 extra because that One that came in late yesterday is a part of the 5, if that makes sense.
Yes, okay. I was just wondering that. And then my question is, it's been about 10 or 11 days since, we've expanded the testing protocols. We've jumped about over 2,000 cases since then. So I'm just wondering, what's your message to people who are worried about seeing these case numbers continue to rise, and those who may look at these numbers and say, well, it's going to continue to rise anyways, whether or not I go outside?
So I would say that the majority of the numbers that we're seeing right now are linked to the big outbreaks that we're aware of, and we're working very hard to control that spread. I think the challenge, if people are saying, well, the numbers are going to rise anyway, what difference does one more person out in public make? I say to you that the difference that one person attending one of these social gatherings who didn't know they were infected and spreading the virus to between 13 and 40 additional people, that's the difference that you can make. And so I think the important part is knowing that this virus is incredibly challenging to control because it does spread sometimes before symptoms start. And so people need to be mindful of their actions, maintain physical distancing, regular hand washing. If they can't maintain physical distancing, consider the use of a mask, a non-medical mask. And the more we limit these gatherings, the more we limit the chance that the virus can jump from one person to 39 others in a single event. So again, I think really the numbers rising should be a cautionary tale, not a tale of futility. And we have control over this. By our actions, we have done incredible things, and the numbers to date have shown that we have the power to maintain this control of the spread together. And I know that people are tired, and I know that they want to get out, and they absolutely can. But we need to remember the physical distancing, hand washing, and to avoid these kinds of social gatherings where the virus can spread very easily.
Excellent. Operator, could you please put through the next question?
Next is Julia Wong with Global. Go ahead, Julia.
Hi, Dr. Hinshaw. Just hoping for a clarification on whether any of the new deaths are in long-term care facilities, and then hoping to get an update on the situation at Kensington Village in Edmonton. The facility says that there have been 3 deaths there and 25 cases in residents and staff. So how concerning is that situation, and have all staff and residents there been tested?
So 3 of the 5 deaths that are new today in the official numbers are from long-term care facilities. And with respect to the question about Kensington, sorry, I have 43 on my list today, so we will be giving an updated list on our website this afternoon, so people will be able to see the numbers. So Shepherd's Care Kensington, so I do have 29 cases, 3 deaths, and absolutely that's a concern for us. I want to remind people that because the incubation period can be up to 2 weeks, we can continue to see new cases in some of these facilities even after all control measures have been put in place. And so that facility is certainly one that the medical officers of health and public health team in Edmonton zone are working very closely with. I don't have information on whether or not asymptomatic testing has been completed there, but we can follow up and get back to you.
Operator, could you please put through the next question?
Next is Alex McCraig with Chat Medicine Hat. Go ahead, Alex.
Hi, Dr. Henshaw. Can you talk about what precautions are being taken at the JBS plant in Brooks to stop the spread of COVID in the city? And also, under what circumstances would you recommend this plant's closure?
Sure. So my colleagues, the local medical officers of health, are the ones who would have the most detail about the specifics that are happening on the site. But I have been in contact with them regularly to understand the work that they're doing. And I want to emphasize that what was very, very clear in the response that we had in the plant at Cargill is that we cannot look at a single work site in isolation of what's happening in the lives of the people who work there. And so I just want to really underline that the plant, there are measures that are being taken in the plant. I understand that The number of shifts has been reduced. The number of people in the plant is lower. Physical distancing, making sure that symptom checks are happening. There are multiple measures that are being taken. But what I also want to really underline is that at this plant, similar to the plant in High River, we know that many of the workers who are working there also live in large households, and we know that we can't focus on the plant in isolation. We need to look at that whole picture and support people in every single setting of their lives, whether that's at their homes, whether it's at their carpooling, their transportation, whether it's at their work site. And so all of those measures are being worked on by my colleagues in South Zone, and they're working in partnership with other stakeholders in that municipality and other groups to make sure that those resources are offered to all of those households. So if there's more information that's required, then that's something we can follow up on. But again, I just want to emphasize that if we look at a work site in isolation, we will not be able to control an outbreak. We have to look at the whole picture.
Operator, could you please put through the next question?
Next is Jason Herring with the Gauntlet. Go ahead, Jason.
Hi there, Dr. Hinshaw. Union Leader Thomas Hesse has been calling on the provincial government to protect frontline food service workers better in light of these large outbreaks at Cargill and JBS. Do you believe that additional measures need to be implemented to protect these workers? And if so, what might those measures look like?
So we have published general non-healthcare workplace guidelines that would be applicable in all non-healthcare workplace settings. But it's clear with the outbreaks that we're dealing with that these particular workplaces may require some additional support. So we do have a team at the ministry looking at the kinds of pieces that, what have we learned from these particular outbreaks that we can provide in advance to these plant operators. So we are working on a guidance document that would help operators of these kinds of facilities to proactively implement even additional measures beyond what was laid out in those more general guidelines. And so that document we're working on as quickly as we can, and are working to have it available ideally by next week because we know that this is an urgent situation.
Operator, could you please put through another question?
Next is Jeremy Sims, I think, with the Western Producer. Go ahead.
Hi, yes, Dr. Hinshaw. I'm just wondering, those 2 additional deaths on top of the long-term care ones, where those deaths are located. And then I'm wondering if you can elaborate on the investigation of the Mountain View poultry chicken facility and perhaps how many cases of COVID-19 are linked there.
Sure. So the other 2 deaths, one was the one that I spoke about yesterday, which was a worker at the JBS plant. So that's in South Zone. And the other one is a male in his 90s from the Calgary zone. And then the other question, was about the Mountain View plant. So I'm aware of 2 cases at that plant. And we are working very hard to make sure that with even one case at a meat processing plant, given again the outbreaks that we've seen, that there's an investigation immediately to ensure that if there is anyone who's deemed to be exposed, that those people are excluded, and that these additional precautions, again, that we're working on to provide to all of these operators, that those are put in place as quickly as possible. So Alberta Health Services is working with that plant to make sure they have the support that they need.
Operator, we'll have the next question, please.
Next is Ryan Rishaw with TSN. Go ahead, Ryan.
Hi, Dr. Hinshaw. Just a question about protocol that's in place when a person tests positive, and the protocols as they exist now in terms of, finding out who they were in contact with, isolating, testing, those sorts of things. As this progresses and we look months down the road, does that scenario ever have the possibility of changing, whereby if somebody tests positive for coronavirus, those who were in direct contact with that person won't necessarily have to do that?
So the current process when someone tests positive for COVID-19 is that the lab report goes to local public health, and each zone public health has the intake process. They would get the lab report, and they would contact that person to find out, first of all, when did their symptoms start, and then by knowing what that date was, they can figure out the period within which they might be infectious, and then what they did and who they were in contact with during that period of time, which now includes the 2 days prior to the start of their symptoms. And so the contact tracers then get all of that information, and then that contact tracing team follows up with all those individuals who have come in close contact with them, because those individuals at this point, when they're close contacts, do need to self-isolate for 14 days. The question about whether or not that will change at some point in the future, whether we will not have to do that kind of contact tracing and requirement for self-isolation, that would happen when and if we have sufficient protection in the population. That could be by way of a vaccine that once that's developed, or depending on the timing of that, we'll be obviously watching to see how many people in our population are infected. And once we have the valid serology testing, the blood test that shows antibodies, we will start with collaboration across the country with doing some blood sampling in the Alberta population to be able to undertake studies of how many people might be infected. The challenge is that as of now, this virus can cause very mild symptoms in many people, but it can cause very severe symptoms and death in others. And even though the highest risk of severe symptoms and death is in those who are older or who have multiple medical conditions, or even single chronic medical conditions like high blood pressure, some people who are otherwise young and healthy can still have very severe disease. So I don't foresee a time in the near future when we would stop doing our contact tracing and notifying those contacts of the need to stay home, because as I said earlier, that's really the only protection we have against widespread of this disease. And a situation similar to what we saw in New York or in Italy is we have each other, and we have our contact tracers who help us to make sure that those who have been exposed know how they can protect others by staying home for 2 weeks.
We have time for 3 more questions. Operator, could you put through the next question, please?
Next is Carmen LaBelle with CTV. Go ahead.
Thank you. Hi, Dr. Hinshaw. I'm wondering, a number of local sport associations I know have been waiting to see if they can have some sort of a summer season. We're talking soccer, baseball, hockey. With the mass gathering announcement yesterday, is this still possible, or I guess what's your directive to these associations at this time?
So we are looking at outdoor recreation as a part of the question of the relaunch and the staging of the relaunch. So I would say to those associations that certainly the opportunity to have many spectators gathering together is unlikely to happen, but whether or not those sports can go ahead, again, will be part of the discussions that we're having with respect to staging of relaunch, when that might happen, and what kinds of activities will be permitted. And I know that people want to plan, and I know that the more advance notice they have, the easier it is to make those plans. But I would just ask people to be patient as we work through these relaunch discussions, and we will be coming forward with more information.
Operator, could you put through the next question, please?
Next is Jennifer Lee with CBC. Go ahead, Jennifer.
Hi, Dr. Hinshaw. I just have a question regarding, I know there's an agreement that's been signed between AHS and the unions today in terms of the redeployment of staff. And I'm just wondering, what do you anticipate in terms of the need for this? How quickly will we see staff potentially redeployed from hospitals to continuing care facilities? How many, and do you have an idea of where you'd like to see these folks go right away?
So I'll maybe comment generally and then ask Dr. Jaffe if he has any additional comments to make. I think that the work that's being done to allow some flexibility in having workers be able to move and support other sites is in many ways a proactive and precautionary step. There have been a few instances, as people know, the Manoir du Lac facility where AHS took over directly operations of that facility. And there have been other facilities that have just been struggling with staffing needs in an outbreak situation where many of the healthcare workers in that location are off on quarantine, not able to work. And so there haven't been, to my knowledge, and I'll let Dr. Jaffe comment further, there haven't been a lot of those instances, but I think it's really important to be prepared because, as I said earlier, COVID-19 will be with us for many months to come, and we need to be doing work in advance to prepare for possibilities and not waiting until we're struggling to be able to make those policy decisions at the last minute. So I'll maybe ask Dr. Jaffe if he has anything else to add.
Thank you, Dr. Hinshaw, and thank you for the question. Let me first start by offering the sympathies of Alberta Health Services and all of those who work for Alberta Health Services to the families who are grieving the loss of loved ones today. I would echo the comments of Dr. Hinshaw. This is really about planning, preparation, and flexibility. I'm delighted that we were able to reach between Alberta Health Services and the three health unions that we work with, HSAA, UNA, and AUPE. We were able to reach a memorandum of understanding that will allow for Alberta Health Services employees to be redeployed into other settings in order to provide care if needed, or will also allow Alberta Health Services employees to volunteer to go and work in other settings. So this is all about planning and preparing, particularly for continuing care outbreaks in which residents may require additional care. We may require additional staff. There may be staff who are off work because they have to self-isolate, and we need to be able to replace those staff. So this is a good news story, and again, I'm thankful that the unions work together with us because ultimately the sole goal of the operators of these facilities, Alberta Health Services and the unions who support the workers who provide the care is to allow us to provide quality care, excellent care to the residents of these facilities while at the same time protecting our healthcare workers.
Operator, we'll take two more questions. Could you put through the next one, please?
Lydia Neufeld with CBC. Go ahead.
Thank you very much. This is a question for Dr. Hinshaw. You talked briefly about the outbreak at Kensington Village. Now, its director of care says that they recently requested testing for all asymptomatic staff and residents, but they say the Edmonton Zone Medical Officer of Health denied that request. Was that the case? And if so, why?
So I'll have to follow up with my colleagues in Edmonton Zone, but the one thing I would say is that when we made the decision to implement testing of asymptomatic long-term care residents and staff in outbreak settings, I did advise my colleagues, the local medical officers of health, that for outbreaks that were currently underway, that they could use their clinical judgment based on whether or not they felt that that particular outbreak would benefit from that testing of all current residents and staff. And that's because if there was an outbreak where there was really no spread happening, if it had been, say, 3 weeks with no new cases, then there may be more risk than benefit with respect to putting people through the discomfort of having tests and when there wasn't much likelihood of having additional cases. So I don't know about this particular instance. We can certainly follow up. But again, the direction that I gave was that existing outbreaks could have that asymptomatic testing based on the clinical judgment of the local medical officer of health.
Operator, can you put through the final question, please?
Final question is Michael King with Global News. Go ahead, Michael.
Hi there, Dr. Hinshaw. Wondering if we can get some clarification on, I guess, what's now being deemed an outbreak at the First Nation in the Calgary zone, where that is, what precautions are being taken?
So with respect to First Nations, those nations work with Indigenous Services Canada, and they are independent with respect to the work that they do within the nation. So I am aware that there are cases in a particular First Nation community, but with respect to the details of what's being done within that nation, that's something that would be best directed to that community or to Indigenous Services Canada.
Excellent. Thank you for coming out, everyone. We will provide another update on Monday. Statistical information and situational reports will be released both Saturday and Sunday. Thank you. Thank you.